Okay, so we're going to wrap up the cardiovascular side of things with this lecture. So again, there's only 2 on cardiovascular. There's going to be 4 on respiratory adjustments. So remember FIC, okay? And so we're going to talk about FIC in terms of what limits our VO2 max and how we could determine a person's theoretical VO2 max. Now we've got this figure here, and I want you to focus on the top half for right now. So I'm just going to draw a line here. We're just worried about this part here, okay? So notice that at rest, what we've got here, so we've got saturation, lost my pen here, and notice that there are 4 oxygens, and so what that represents is just cardiac output. During rest, we're only pulling 1 out of every 4, okay? We're only using about 25% of the available oxygen. However, during exercise, our blood flow increases, so now we're focusing on this bottom part here, so our blood flow increases by 4 times. Okay, that helps. But what also happens is we increase our extraction by 3 times. And so as a result, we can go from having a VO2 of 4 at rest up to 48. Okay. And so obviously we've talked about it. You can actually increase your blood flow by up to 8 times if you're an elite athlete. And so we can increase our VO2 by more than 12-fold. But this is how we're able to do it. We increase blood flow, we increase extraction. And so our resting heart rate, depending on the person and the fitness level, can be anywhere from 28, that's the lowest I've seen, to 100. Typical person is between 60 and 80. So your heart rate max doesn't really change, but it decreases slightly over time. We'll actually talk later about how it can change with training as well. So what happens is when we start to exercise, we have a sympathetic response. It's a fight or flight response. And so this increases, and not only does it increase when we start to exercise, but it increases along with the intensity. So there are some problems or concerns or challenges associated with that. One of those is related to filling time. So what happens to filling time during exercise? Well, as we've discussed, filling time is reduced, right? So we've got 2 conditions here, and I'm trying to find my line. There we go. So here's reduced filling time. Here's typical filling time. And so as a result, if we just change filling time and nothing else, we're going to have a reduced stroke volume. And if I have a lower stroke volume, I potentially have a lower cardiac output. Okay, it's not exactly that way, because if you've got reduced filling time, that means you've got a higher heart rate, and they probably compensate for each other. But when we exercise, we need a greater than normal cardiac output. Okay, and so it's not enough just to have heart rate increase by 10%. If stroke volume decreases by 10%, we're going to need to increase both of those. All right, so this can be tied into end diastolic volume. Remember, end diastolic volume is preload. And so when we have a greater end diastolic volume, we have a greater stroke volume, and that's shown by this figure over here. So more blood that returns back to the heart, the more stretched out the heart gets, the more blood will leave the heart, or in other words, we'll have a greater stroke volume. And so if we can bring more blood back to the heart, we're going to have a higher stroke volume. If we have a higher stroke volume, we can have a higher cardiac output. Not only that, but with this increase in sympathetic activity or sympathetic tone, that can lead to a greater stroke volume, right? And so if we see from this figure here, again, going back to end diastolic volume or preload, we're going to focus here. On the y-axis, we've got stroke volume. This sympathetic response shows that we'll have a much greater stroke volume if we have a sympathetic response. And so it does this by increasing the strength of contraction, and that happens because more calcium is able to get into the muscle cell, more calcium, more cross bridges, more force. This will result in it'll have no effect on end diastolic volume, but it will decrease our end systolic volume. And since stroke volume is end diastolic minus end systolic volume, that will mean we have a greater stroke volume. So we can look at it this way. So here we've got 3 different conditions. So we've got normal stroke volume. So we haven't changed anything. Think of it, we're at rest. So end diastolic's 135, stroke 70. Which means we have an end systolic volume of 65. Our ejection fraction, which is percentage of blood that leaves the heart during contraction, would be 52%. Now, if we don't change preload, don't change venous return, don't change the amount of blood that's returning to the heart, but we have a sympathetic response so that the heart is contracting harder. Well, now our stroke volume increases, and so doesn't affect preload, doesn't affect end diastolic volume, but we're getting more blood out. And so we're going to have a stronger contraction. So just with that increase in stroke volume, we're going to increase cardiac output. But now if we have increased preload and we have that increased sympathetic response, our stroke volume goes up even more. We'll have a greater ejection fraction. And so now we've doubled our stroke volume. Okay. And we're going to talk about this more in a couple weeks. But training has an effect on stroke volume, right? But I want to focus on this figure over here. So notice that intensity, as we go this way, as indicated by the speed that we're running, what ends up happening is we get this plateau here, okay? And the reason being is we hit a plateau just because heart rate's so fast, and we get to a point where it's insanely quick, right? So we talked about how if your heart rate's 200 beats per minute, you've got 0.3 of a second to go through a full cardiac cycle. There's only so much blood you can get in and out. All right. Now, in an untrained person, notice that on this right figure, that stroke volume remains relatively flat, maybe increases a little bit. However, in the trained individual, stroke volume increases up until we get to about 180, maybe even a little bit more. Okay. And as a result, we have increased cardiac output because we have such high stroke volume. Okay. I mean, if you look at here, 180 versus 120, well, this person here, this trained individual, is going to have a cardiac output that's 50% greater. So stroke volume increases with intensity between up until about 40 to 60% of VO2 max. But if you're highly trained or an elite athlete, it might actually keep increasing up until VO2 max. And so this is increased due to a variety of things. Okay, so we've got Frank Starling, which means we're bringing more blood back to the heart. This is occurring due to the muscle pump and the respiratory pump and the torsion of the heart, those sorts of things. And then you've also got the fact that it's going to be able to eject more blood due to that sympathetic nervous system. So how can we, not explain, but how can we increase VO2 during exercise, and describe the effects of sympathetic nervous system that can occur during exercise?